Hi, my name is Fereshteh Salimi-Jazi. I'm a pediatric surgery research fellow at Stanford and general surgery resident at UTMB. We don't have any disclosures. Despite recent medical advances, high-risk neuroblastoma still have a poor prognosis. While MEK amplification predicts poor clinical outcomes, it only presents in a small fraction of tumors, suggesting additional pathways contribute to the disease, including TERT, ATRX, and RAS. The focus of this study is on RAS pathway. RAS GTPase are the most frequently mutated oncogene family in human cancers, with 19% of cancer patients have activating mutations in either H, K, or N-RAS genes. However, many tumors lacking RAS mutation require RAS activity as part of the tumorigenesis process. Despite a low occurrence of RAS mutation in neuroblastoma, elevated RAS activity is emerging as a potential contributor in neuroblastoma. Based on this, we hypothesize RAS inhibition using the NS1 monobody can delay both adrenal tumor formation and bone marrow metastasis. Monobodies are single-domain proteins of 95 amino acids that achieve levels of affinity and selectivity similar to antibodies, yet are insensitive to the Rhodes potential of their environment. RAS monobody NS1 inhibits HRAS and KRAS-mediated signaling and transformation through targeting a critical allosteric regulatory site. Since NS1 blocks both wild-type and mutationally activated RAS, it provides a unique opportunity to probe the importance of RAS in various biological contexts, given lack of available RAS inhibitors. In this study, CHB134 human neuroblastoma cells, which are MEK amplified with high HRAS, were infected with a lentivirus encoded with doxycycline-regulated NS1 construct. A study had two components. In vitro, CHB134 NS1 cells were treated with or without doxycycline, and proliferation assay was performed. Additionally, ERK-MAP kinase activity was determined by Western blot. In vivo, CHB134 NS1 cells were injected into the adrenal gland of immunocompromised mice to generate orthotopic tumors. Adrenal tumors were monitored by ultrasound and metastasis assessed by staining of bone marrow aspirations with FOX2B. Mice were treated with or without doxycycline, either immediately at the time of tumor cell injection or in a delay manner when adrenal tumors reached to 50 to 100 cubic millimeters. Proliferation assay in the left side shows that addition of doxycycline to CHB134 NS1 cells decreased their proliferation, and the Western blot in the right side shows that treatment of CHB134 NS1 cells with doxycycline decreased levels of activated phospho-ERK levels compared to the control. For adrenal tumor assay, addition of doxycycline prolonged the time for tumor to reach to 500 cubic millimeters. Tumors in non-treated mice reached to this size after 36 days, whereas delayed treatment with doxycycline prolonged it to 47 days, and immediate treatment with doxycycline prolonged it to 97 days, significantly longer than the two other groups. When bone marrow aspirate was examined, doxycycline treatment delayed the time to reach to a certain percentage of metastasis. For example, 5% of the aspirated cells from bone marrow of tumor-bearing mice with immediate doxycycline treatment were positive for FOX2B after 38 days, which was significantly longer than those without doxycycline treatment, which took 18 days. Similar results was seen for 2% and 1% involvement. In summary, RAS inhibition decreased cell proliferation and ERK activation in MEK-amplified neuroblastoma cells and delayed both adrenal tumor growth and bone marrow metastasis. Based on this result, RAS inhibition may be a potential treatment strategy for certain subsets of neuroblastoma. Thank you for your attention.
I have a question for you, just in that it just seems that RAS is very much associated with other types of tumors, not so much associated with neuroblastoma. Has this type of experimentation or therapy been looked at in these other tumors, even adult tumors that are very RAS involved?
This specific experiment?
Or something like this, the same type of strategy?
I'm not sure if it was done for other kinds of cancers, but you're true that RAS is involved in a small fraction of tumors, but it affects progression of the tumors. It's important to inhibit that. Also, based on the study that was done in Dr. Mari's lab, which was published in 2015, they saw high activation mutation of RAS pathway in recurrent neuroblastoma, so it can help with like relapsed or recurrent tumors.
Yes, I saw that. So where do you see this experimentation going from here? Not clinically, but the next set of experiments.
So we are approaching this in different ways. We are like, first of all, the NS1 cells that we are like monobodies that we are experimenting are in big size, and it's hard to penetrate into the cells. That we already developed penetratable kinds of NS1, but have not able to get to the concentration to inhibit RAS. So one of the pathways that we are working on is that. The other pathway is working on different kinds of cell lines. The cell line that we work now is for with MECAN amplification and HRAS, but there are other cell lines that have not MECAN amplification. So we want to make sure that these kind of results are employed for other cell lines too. And the last one is working on recurrent type of neuroblastoma. We already developed a recurrent or relapsed type of neuroblastoma model that we want to experiment that.
Great, thank you.
Thank you.
Thank you.